Okay, Dr. Huebner here, Natural Transplants. I'm here with Andrew. You may remember Andrew from his surgery day where we documented the process of the surgery. He's now at exactly 50 days or 7 weeks post-op, and he's just coming in today for a checkup to make sure everything is going okay. Things are going great. The things that a little concerning for him were, I have a couple little pimple-y areas, and what those represent are ingrown hairs that will basically things are waking up. So when things start to wake up, sometimes you'll get a little area that looks like a little zit, and the hair will work its way through. Nothing to be concerned about. As you can see here, he has a little area where the grafting was. It's still a little bit red, but that will slowly fade. Every week that goes by, it's less and less and less. At this point, he would be able to wear a little makeup or cover up if he needed it, but that's really up to him. Andrew, how has the process been getting back to normal life?
It's been very easy to get back to normal life. I'm back at work. I'm not covering my head. I see a lot of people at work, and only one person has asked me if I had a sunburn. Other than that, it's been nothing. So it's been fine. A couple of itches in the back on the suture line, but back to normal, really.
Yeah, and so things, that the suture line, just because you take the sutures out doesn't mean the suture line is done. So the suture line continues to heal and fade over up to a year. So even now, I'm going to show you the suture line. You really can't see much of it. So if you want to come in here and take a look, we can zoom in a little bit more on his hair. But as you can see, you really can't tell much going on. A little bit of redness here. These are those little areas of hairs that are sort of waking up, and it almost looks like a little ingrown hair or zit or something like that. But very, very mild. And you can see where his new hairline is going to be, just from the area of redness where it's nice and staggered all the way around. When we got back into his existing hair, so it's not just this little area here. He's going to have hair and thickness all the way through here. So I'm going to turn you around here and show you the suture line. So nice thing for Andrew is he has a really nice hair type, nice curly hair, and also that tends to lend itself to having more ingrowns as things come in. But use this other oops. So there's the suture line. I keep saying as if somebody took a pen and drew a line. That's the thickness of a suture line. I hope the camera picks that up. It almost is hard to tell from a crease, just a regular crease in the hair. Right there. You see that little line? Around there. So if you put your comb through the hair, you just really can't see anything. So, okay. Maybe you can see there, Gus. So, Andrew did a great job taking care of it. Can't wait to see his results. Obviously, at this point, 7 weeks in, you wouldn't expect any growth. Growth starts at generally around 3 to 4 months. Starts out very thin, and then slowly will gradually get thicker, thicker, thicker. Looking forward to seeing your progress, Andrew, and thank you again for showing patients, prospective patients, what to expect after surgery.
Pleasure.